This is the dawn of a new age, said the chair of the British Fertility Society following the announcement of the first ever womb transplant in the UK. A woman with 2 children of her own already has helped her sister, who was born without a uterus, and the sister is now preparing to have her own embryos implanted. An incredible scientific accomplishment, and wonderful to hear both sisters are doing well, but are there ethical questions which perhaps need to be raised here? The removal of a woman's womb, or hysterectomy, is a significant operation and carries risks to the person involved. Here to discuss this important issue, I'm joined by Dr. Trevor Stammers, a university lecturer in medical ethics, who was a GP for over 30 years. Dr. Trevor, thank you for joining us. If you could start out with giving us what's your take on the risk of this operation, first and foremost.
Well, I think the significant point from an ethical point of view, and it's connected with risk, is that clearly there's risk with any organ transplant to the donor and to the recipient. But usually organ transplants are life-saving operations. So this, of course, is different in as much as the intention of it, and hopefully it will, give life to a new baby because of this transplant, but it isn't life-saving. And so the risks need to be put first of all, I think, in that context. And the risk in this situation with a transplant is greater than with a hysterectomy. And the reason for that is that hysterectomies are normally done for disease, cancer, endometriosis, and so on. And the sole object of the operation is to remove the womb. In a transplant, you need to remove vasculature, blood vessels, so as to make good connections when you've transplanted it. And so that takes more time, and there is therefore more risk than there would be with a hysterectomy. The risk of death in that is small, of the order of 1 in 1,000, depending on the method used. So this would be a little bit higher. But there are other risks as well, bleeding, infection that occur with any operation, of course. So it's not risk-free for sure.
Well, since there seems to be a higher risk in this operation, and it's not a life-saving operation, it's elective, do you think there'll be medical professionals that opt out of even doing this procedure?
I think there will always be surgeons willing to do it. I'm more concerned about the area of consent and the information that is given to patients. I mean, it's interesting that you quoted somebody as saying this is the dawn of a new age. In fact, the first one of these womb transplants was done in April 2000 in Saudi Arabia. So the new age is actually 24 years on, isn't it? So it has been around for a while. And folks have had severe complications. That woman in Saudi, in fact, had to have the womb removed after 99 days because there was a massive clot, which is thrombosis, which is another risk. So I think that accurate information needs to be given about the risk, and then for the patient to make the choice. But the other thing is that, of course, having a successful transplant is a first stage of a dual stage necessity in order to have children. You've still then, once the transplant's been hopefully not rejected or had any major complications, you've then got to deliver a baby with it. And I notice some clinics in the States are massaging the figures and saying that they're having success rates of sort of near 80%. And that's because they're only counting in the figures the successful transplants, and about a third of them fail. And obviously, if you exclude those, you're going to boost your figures. So the chances of pregnancy are about 50%. I think there've been just over 100 done worldwide and about 50 babies born. And that's another thing that needs to be made very clear. And that's only right because obviously the desire to have a child, to be considering a child of your own, to be considering this operation is a very, very strong desire, but it does need to be put in the context of the risks and accurate information given.